It's not an aesthetic question here. The main reason why I recommend orthodontic treatment to my patients is when I see that the function is being compromised. No matter whether you choose braces or aligners, how well you follow the advice given by your dentist or orthodontist will make a huge difference in the results. Imagine wanting a low profile look while still getting the job done. Ceramic braces blend in beautifully with your natural teeth. Metal braces are designed for durability and can handle a bit more forces, and they are less prone to damage. So which option should you pick? I'm Dr. Maria Florou, and this is Mind Your Mouth. I'll be sharing with you the truth about oral health that most people completely overlook. If you're ready to go beyond the basics, challenge the myths, and truly transform your well-being, let's get started. Today, we're having an interesting conversation that will help you understand the difference between braces or aligners. If you're not sure if you need orthodontic treatment, or if you're considering why should you get your teeth straightened, we need to talk about it. It's very important that you understand not just your options, but whether you consider and need treatment or not. So why do we consider orthodontic treatment? Why do we consider teeth alignment? It's not an aesthetic question here. The main reason why I recommend orthodontic treatment to my patients is when I see that the function is being compromised, and not just the function on those first years of life or at that stage of life, but how that's going to impact the health and the longevity of not just the teeth, but the bone structure that's holding those teeth in place. So sometimes what I see is patients that come to me and they feel they have like kind of a nice smile, but when I'm looking at them, the teeth are so misaligned, or the way that the jaws meet is actually hurting the bone and gums. Let's say sometimes I see patients, and that's a very common issue actually, where the gums are receding and we're starting to have some indentations happening on the bone, and people don't know why that's happening, and they led to believe that's because they're heavy brushing, but in fact the bite is causing that. Let me help you understand that a little bit better. I'm just going to get my models here to help you understand why that can be an issue for you. This is the ideal bite that we generally want to see. And why is that? Because when the teeth meet in this perfect alignment, the forces of chewing are evenly spread through the root of the tooth and then through the bone and the skull. And what happens now when I have, let's say, a deep bite, or when the lower jaw is a little bit small and we have the bottom jaw positioned a little bit backwards. So if I move my model and I have a bite that's like this, which is not uncommon to see, it's one of the most common ways that we see our patients, especially kids, biting. And what's the problem with this? Oh, it still looks nice on my smile and I don't see any problems. But in fact, when the bottom jaw is moved backwards, we have more pressure forming on the joint. And we tend to see those adults when these kids become adults, or even when we're looking at adult patients, we tend to see more joint trouble and headaches because the pressure is actually happening from the jaw and from the bone all the way up into the joint that's here. And this is all intimately related to what's happening in our skull and blood flow, muscles, and it's a whole complex system that works together for us to chew. So these are the main reasons. One other reason that I decide that my patient needs to have braces is when there's a little bit of a cross bite. So the bite is a little bit like that. So instead of the chewing happening in the middle of the tooth structure, it's actually happening on the side of it. And by doing so, the way that the forces impact on the teeth cause the gums to recede and the bone to shrink with the gum recession. So when we look at gum recession, we need to bear in mind that the gums are actually protecting the bone. But if the gums recede, they're not receding alone, the bone is also receding. And if we leave this as a long-term problem, we will see problems when people age, when our patients age. So it's a very important concept to understand that orthodontics are not an aesthetic matter, but it's a matter of health and longevity. The other thing that I see is when people don't have effective chewing, what happens is that they swallow bigger chunks of food. The whole digestive system is actually suffering the consequences of the non-effective chewing because it ends up having to deal with bigger chunks of food, the food absorption, the way that the nutrients are broken down changes because we don't have that effective breaking down and saliva starting to digest the food in the mouth. So then the whole system flows with less stress. When we have bigger chunks of food, we tend to see that the digestive system is also going to give some subtle signs of problems, and sometimes even nutrient absorption can get affected by it. So now let's look at the options. When we come to the conclusion that yes, we need help, yes, I need help to have my teeth straightened and to improve my chewing function and the longevity of my smile. So when we are faced with this scenario, we have two main options nowadays for grown patients. So we're going to talk about children on another episode, but I'm talking about teenagers and adults especially. Anyone from, let's say, 10, 12 years old and up, we want to consider aligners or braces in those cases. But first, let me ask you a question that often sparks debate in our practice and friends. What if I told you that the choice you make could influence not just your smile, but your entire treatment experience? Stick around, and by the end of this video, you not only know about the difference, but also about the crucial factors that might sway your decision. Let's start with the ceramic bracket options. So brackets, it's when we have something attached to the teeth and a wire is placed around, and then movement happens when you go and see the dentist and they activate that wire and you start feeling some movement there. So we have the option of ceramic brackets first. So let's kick things off by talking about ceramic braces. Think of them as the undercover agents of orthodontics. These brackets are crafted from tooth-colored or clear materials, making them much less noticeable than traditional metal braces. Imagine wanting a low-profile look while still getting the job done. Ceramic braces blend in beautifully with your natural teeth, making them a popular choice for adults and teens alike. But here's the kicker. While they work almost as effectively as metal braces, for most cases, metal braces may have the upper hand when it comes to complex tooth movements. And why is that? Well, metal braces are designed for durability and can handle a bit more forces, and they are less prone to damage. Now, let's talk about comfort. Many users find the ceramic brackets a smoother and less irritating to the cheeks and gums. However, a word of caution here. While ceramic is strong, it's not as tough as metal, and those brackets can chip and crack if you're not careful with them. So following those food restrictions that your dentist has discussed with you is crucial for ceramic wearers. So things that we talk about, don't bite on a lolly, actually, don't bite on a lolly anyways. But things that are hard to chew, you really should avoid them or cut them with fork and knife and eat them in smaller pieces, because otherwise there is a chance that your ceramic brackets will chip off. And now here it's a fun fact, and a lot of people like choosing that. The brackets themselves resist stains and they are clear, but the elastics that are put around them, you can actually choose the color and they tend to stain. So if you're a coffee lover, a curry lover, red wine, or your hygiene standards are not great, we should really consider which materials are we using here. Now, I want to hear from you. Would you choose ceramic braces for their subtlety, or do you prefer the classic metal look? Now, let's talk about metal braces. We have a recent talk about metal braces and EMFs, which is the electromagnetic field. Now, on this topic, there are many people buzzing and talking about EMF exposure. With so many wireless devices surrounding us, some people are curious to understand if metal braces could amplify these fields. What does science say? Studies indicate that metal in braces can indeed increase the absorption of electromagnetic radiation. Think of the radiation from mobile phones, for example. This is measured as SAR or SAR, specific absorption rate. And metal can reflect or focus these electromagnetic fields, potentially increasing exposure right around your mouth and head. But here's the kicker. Research has also found that with this EMF exposure, there's an increase in nickel release from metal orthodontic brackets, from 10 to 20% of the population that's sensitive to metal. For the 10 to 20% of the population that's actually sensitive to nickel, this could be relevant. So that's why I wanted to mention here with you. Now, while the increase in metal ion release is measurable, current studies have not demonstrated that this leads to significant health risks for most individuals. However, if you know you are allergic to metal, it's definitely worth discussing alternatives like ceramic braces or aligners with your dentist. What we know nowadays is that there's still research needed to determine the effects of EMF and metals in the body. We're still in early stages of this, and as I've just mentioned, the research is not clear and we don't have current research showing damaging effects to the body. We are surrounded by EMF anyways. That in the modern society that we live nowadays, we have no option. We can find ways to minimize our exposure, but we are exposed to EMFs wherever we go. Now, from a regulatory perspective, agencies have acknowledged that metal objects in or on the body can interact with certain energies, but there's no consensus that braces pose any major risk on everyday EMF environment. Now that you heard me saying this, share with me, how do you feel about EMF exposure and braces? Type here your comments. I want to understand what people are thinking about all this. Let's get real for a moment. Compliance is the unsung hero of orthodontic treatment. No matter whether you choose braces or aligners, how well you follow the advice given by your dentist or orthodontist will make a huge difference in the results. For aligners, here's what you need to keep in mind. Those aligners need to be worn for 20 to 22 hours a day. Forgetting to put them back in or taking them out too often will result in a delayed progress and stretch the time frame of your treatment. Just before we go deeper into this conversation, I want to show you what aligners are. Real quick. Your mouth is the gateway to your overall health, and at Casuarina Dental, our focus is on you. If you're ready for a holistic approach to dental care, book your appointment now via the link in the show notes. Now, back to the episode. So these are aligners. There are different brands nowadays. There's a lot of research, a lot of data behind them. They work very, very effectively. So these aligners, and they sit on teeth like this. And they're quite clear. You can barely see that they're there. So when I'm talking to my patients and I'm explaining to them what's the difference between having braces, regardless if we're going metal, ceramic, or aligners, what is important to understand is that the braces are placed and the wire is placed and activation happens, which means movement happens, or the start of the movement happens when you see the dentist. With aligners, it's a little bit different. When we decide to do the treatment plan for aligners, each aligner comes with a very special technology. And each aligner has, if you have a closer look here, what we call attachments. The attachments are placed on teeth and they click with the aligner when the aligner is in place. And every time we replace the aligner, which normally happens between 7 to 14 days of wear of each one of these aligners, we give our patients a series of aligners. So let's say 4 aligners for every time we see them, or 6 aligners, and they replace them every so often, depending on the treatment plan and advice given to the patient. But each aligner puts a different pressure on teeth. So we don't need to activate the wire that goes around the braces. With this one, the technology lies inside the aligner, and each aligner creates a different movement on teeth. So here is a stat for you. Studies show that younger patients and males tend to be more compliant with aligner wear. But as time goes on, compliance can drop off. Staying motivated is key, because if we don't have the aligner in place, we don't have any movement happening. Keeping up with regular orthodontic visits is another crucial factor for the success of your treatment, because we need to monitor the progress, and in the case of braces, we need to make adjustment, and sometimes in the case of alignments, we also need to make some adjustment there. And don't forget another crucial point of this conversation, which is oral hygiene. So braces require extra care, and they're a little bit harder when it comes to flossing, because you actually need to thread around the wire in order to floss. I also like the water flosser a lot, as I mentioned on other episodes, and you can squirt water under pressure around your teeth, gums, and brackets in order to clean them. But when it comes to comparing with aligners, because aligners are removable, you remove your aligners for eating, drinking, chewing, and brushing and flossing. So then you have full access to your teeth in order to maintain them clean. Neglecting oral hygiene will cause gum disease, staining, and prolong your treatment, because it is hard and a little bit more complex to treat or to have an orthodontic treatment when we have gum disease. So let's make this a little bit more interactive. How confident are you in sticking into your treatment plan, whether it's wearing aligners or caring for braces? Share your tips, share what you do if you've ever had aligners in the past or braces. What were your struggles, and what are the tips that you can give to other people that are watching this channel in order to make their life better? So just to sum up here, I think that by now you understand the difference between braces, ceramic brackets, metal brackets, and aligners. But what happens after your treatment is done and we finish, we're happy with the results, your function is perfect, your smile is beautiful. It's such a nice appointment, such a nice visit when people come in and it's the final visit and we're all happy with the results, because we need to be happy and the patient needs to be happy. So that's a really nice appointment when we have this. But then it comes the conversation. How are we going to do in order to maintain the teeth in the position that we have moved them to be? So imagine that your tooth is not fused with bone. We do have a little bit of space between the bone and the tooth here in order to allow for movement and for cushion effect from chewing, so then we don't break. So we have a little bit of a cushion between those two layers. When we move teeth, we're actually stretching those rubber bands, the ligaments that we have between bone and teeth. And what happens with that is that while we're holding that pressure, so imagine like the rubber band being stretched with the orthodontic treatment, it remodels itself and it changes shape over time. But when we release the rubber band, it still has a memory, and it will tend to go back to a degree to its original shape and position there. So what we need to consider, we do need to consider retention. Nowadays, the retention, the studies on retention has changed a lot, but the latest recommendation is that we need long-term retention. In the past, we used to believe that 2 years of retention was enough to create new memory on the cells that hold the teeth in place, but we ended up seeing a lot of relapse. The relapse happens not only because of the rubber band that's holding the teeth in place, but also how the muscle posture is influencing the new position of teeth. So when the tongue sits on teeth and it implies on a lot of forces resting on those teeth, we'll tend to see movements happening again. Or depending on how your biting and swallowing is going, we see like people that swallow like this. All these forces actually put pressure on teeth, and we tend to see recurrent issues with post-orthodontic treatment. What we do at our practice, we actually address that muscle, we address the muscle function, and we re-educate the posture of muscles to minimize the chances of relapse. But when it comes to retention, nowadays, what we can consider as long-term retention is putting a wire behind the teeth or some form of splint behind the teeth that is going to keep the teeth in place, and we bond that. Or we can have something like the aligner, very similar to this, but it's actually a retainer. It's worn at nighttime every night for many years. Nowadays we don't have a time frame when we advise our patients to stop wearing these or to stop having the splint behind their teeth, because we know that the chances of recurrent movement will still exist. As we wrap up this episode and we understand better the differences between braces and aligners, remember that the choice ultimately comes down to your needs, lifestyle, and priorities. Whether it's aesthetic, comfort, health factors like allergies or EMF sensitivity, or simply your ability to stick with the plan, it's all part of the decision-making process. All these are taken into account when we decide what is the best option for you. Have you ever struggled with compliance? I want to hear your stories, questions, or tips and comments on this below. But if you struggle with compliance, definitely considering a fixed option like braces is the way to go for you. If you say, no, I have quite a bit of discipline, I know that I'm going to comply with my treatment, then there are basically no limitations nowadays with aligners. We achieve great results with aligners as well as braces. So it really comes down to a personal decision here. Your smile journey is uniquely yours. Embrace it and make every step of the way count. Until next time, keep smiling and remember to always mind your mouth. Thank you for tuning into Mind Your Mouth. These episodes have been created for you. If you found this conversation helpful, the best way to support the show is by leaving a 5-star review on Apple Podcasts and Spotify. And don't forget to subscribe on YouTube so you never miss an episode. For more tips on holistic dental health, follow me on social media at Casuarina Dental. In the meantime, take care of your smile, take care of your health, and I'll see you in the next episode.